Welcome back to Have More Babies. We know you've got some source material with you today, a parent guide that tackles something pretty serious, epiglottitis.
Yeah, it's one of those things, isn't it? You hear the word, it sounds rare, but if it happens, it's critical. Absolutely need to know information.
Right. And that's the goal today, really. Not to scare anyone, but to make sure you know the signs, those specific red flags.
Exactly. So you can tell the difference between, a nasty cold and something that needs immediate action. This stealthy invader, as the guide calls it.
Yeah, let's arm you with that knowledge. We'll look at symptoms, causes, why it's so urgent. Okay, let's unpack this. Can you start us off? What exactly is the epiglottis? Why is it so dangerous if it gets inflamed?
Okay, yeah, the anatomy is key here. So picture the very back of your tongue, right at the top of your windpipe. There's this little flap. It's shaped kind of like a leaf. That's the epiglottis.
Just a little flap.
Yep. Tiny but vital. Think of it like a traffic cop for your throat. When you swallow, it folds down, covers the windpipe. Make sure food goes down the esophagus, the food pipe, not into your lungs.
It's the guardian of the airway. Got it.
Precisely. So epiglottitis. That's when this flap gets inflamed, infected, and swells up. Usually it's bacteria causing the trouble.
And if it swells?
Right. It doesn't just get irritated. It can swell so much, it blocks the opening to the windpipe. Like a big balloon plug in the hole.
Wow. Okay, so it's a physical blockage. That's why things can go bad so fast.
Exactly.
Yeah.
It's pure mechanics. The airway is narrow, especially in kids, and this swollen flap just obstructs the airflow. That's why recognizing it quickly is everything. What's fascinating here is understanding that simple function, that job it does, tells you why the symptoms are so alarming.
Right. If it can't guard the airway, or worse, blocks it, that explains the emergency.
Airflow gets restricted, fast. Time is absolutely of the essence.
Okay, so knowing that function, let's talk symptoms. The real red flags parents need to spot. What should people be looking for?
We're looking for a few key things that tend to pop up really quickly, often just over a few hours. First, usually there's a sudden, very high fever, like spikes quickly. The body's reacting hard.
Okay, high fever. Lots of things cause that in kids, though, right? Flu, strep.
True. That's why you look at the whole picture. The fever is usually just the start. Because of the swelling, the next thing you'll likely see, and it's directly related, is difficulty swallowing. It hurts a lot.
Ah, because swallowing pushes on that swollen flap.
Exactly. It becomes incredibly painful to swallow anything, even their own saliva.
And if they can't swallow their saliva?
Then you get the third classic sign, excessive drooling. They literally can't manage the saliva because it hurts too much or it's too difficult to swallow past the obstruction. So high fever, obvious trouble swallowing, and then sudden, significant drooling, that combination. That's a major warning sign.
Wow, okay. So the drooling isn't just incidental, it's a direct result. What about breathing? Is there a specific sound?
Yes. And this is probably the most frightening sign. It's called stridor, S-T-R-I-D-O-R. It's this harsh, high-pitched noise, usually when the child breathes in.
Like a squeak or a gasp.
More like a harsh, sort of strained whistling sound. It's the sound of air struggling to get through that narrowed airway. It's a clear sign of significant obstruction.
Now, some parents might know about croup, which also involves a breathing sound. How do you tell the difference, especially when you need to act fast?
That's a really, really important question. Croup typically causes swelling below the vocal cords. That leads to that classic barking seal cough and a hoarse voice.
Yeah.
Epiglottitis is swelling above the vocal cord.
Okay, above versus below.
Right. So with epiglottitis, often the child's voice sounds muffled, like they have something hot in their mouth. They might not cough much at all. And the stridor, that high-pitched sound, might be constant or worse when they're upset, rather than just the barking cough of croup.
So let's recap. Sudden high fever, can't swallow, lots of drool, maybe a muffled voice, and that harsh, high-pitched sound when breathing in. No barking cough necessarily. That's the danger combo.
That's the triad, yes.
Yeah.
And one more thing you might see is posture. A child really struggling to breathe might adopt what we call the tripod position. Yeah, they'll lean forward, maybe put their hands on their knees or the bed, stick their chin out, neck extended. They're instinctively trying everything to open up that airway just a little bit more. If you see that position with the other symptoms, don't wait.
That image, leaning forward, fighting for breath. Okay, this isn't a wait and see or call the doctor in the morning situation. This is 911 or straight to the ER, right?
Absolutely. Immediate emergency care, no question. And critically, try to keep the child calm. Getting upset, crying hard can actually make the airway spasm and close up more. Calm is key on the way to the hospital.
Knowing how fast this happens, let's shift. What causes it? You mentioned bacteria.
Yeah, historically, the number one cause, a big one, was a bacteria called Haemophilus influenza type B. We just call it Hub.
Hep, okay.
It was really common and really aggressive in causing this severe swelling. Now, Hib is still a major cause, but we also know other things can trigger it. Other bacteria, like strep, sometimes viruses, though less commonly, and even physical injury to the throat area, like a burn from hot liquid.
Hib. That name rings a bell because of vaccines, right? This leads us to prevention.
Exactly. And this is the huge success story here, the Hib vaccine. Before the vaccine became routine in the late 80s, early 90s, epiglottitis was much more common. Pediatric ICUs saw it regularly. It was terrifying.
So the vaccine changed everything.
Dramatically. Widespread Hub vaccination has almost wiped out Hib-related epiglottitis in places where the vaccine is used. It's a true public health victory. Turned a common pediatric emergency into a rare one.
That's incredible. Does the vaccine stop all types, though, since you mentioned other causes?
No, and that's important. It stops the most common historical cause, the Hib bacteria. It won't stop cases caused by other germs or injuries. So while it dramatically reduced the numbers, the condition hasn't vanished completely. That's why knowing the symptoms is still vital.
And basic hygiene probably helps, too.
Always. Good hand washing, covering coughs, all the usual stuff helps reduce the spread of infections generally. Basic, but effective.
Okay, so prevention is huge, especially the Hib vaccine. But if the worst happens and a parent gets their child to the ER with these symptoms, what happens then? How do they diagnose and treat it safely?
Right, so in the ER, if they suspect epiglottitis, the number one rule is keep the child calm and don't poke around in the throat.
No tongue depressor?
Absolutely not.
Okay.
Trying to look down the throat that way could trigger a complete airway spasm. It's incredibly dangerous. So diagnosis is often based on the clinical picture, the symptoms we talked about.
How do they confirm it then if they can't look directly?
They might do a gentle observation. Perhaps a quick lateral neck x-ray done carefully with the child sitting up, often on a parent's lap. This can show the swollen epiglottis. Sometimes it looks like a thumbprint on the x-ray, the thumb sign. They'll also likely draw blood quickly to check for signs of infection and try to identify the bacteria.
Okay, so careful observation, maybe an x-ray. Once it's confirmed, what's the immediate treatment?
It's swift and intensive. It requires hospitalization, almost always in the intensive care unit, the ICU. They'll start high-dose IV antibiotics immediately, even before they know the exact bacteria. And the most crucial part, securing the airway, providing breathing support.
Breathing support, how? If the airway is blocked.
This is where it gets very serious. While they might try oxygen by mask initially, the definitive and often safest way is intubation.
Putting a breathing tube in.
Yes. Inserting a tube past the swollen epiglottis directly into the windpipe to guarantee an open airway. Because this procedure itself carries risk in this situation, it's usually done in a very controlled setting, like an operating room. Yeah, often by the most skilled people available, an anesthesiologist, maybe an ENT surgeon, to make sure it's done safely and quickly. The child stays intubated, usually on a ventilator, until the swelling goes down with the antibiotics, which might take a few days.
That whole sequence, from fever and drooling to potentially being intubated in the ICU, it really highlights how serious this is.
It really does. And, if we connect this to the bigger picture, epiglottitis is such a stark example of modern pediatric care. You have the incredible power of prevention, the Hib vaccine saving countless lives, but also the absolute need for parents and doctors to be ready to recognize those critical airway emergencies instantly when they do occur. It's that balance.
That's a great way to put it, prevention and readiness. So what does this all mean for you listening? Let's boil it down. Epiglottitis is rare now, thanks mostly to the Hib vaccine, but it is a true medical emergency. Knowing those key signs, the sudden high fever, the difficulty swallowing causing drooling, that high-pitched breathing sound called stridor, maybe the muffled voice, knowing those means you can act fast. And acting fast saves lives.
Absolutely. And don't forget the foundation. Keeping up with vaccinations, especially Hib, is your first line of defense against the most likely cause of this scary condition. Prevention first, then vigilance.
We really hope this discussion helps you feel prepared. Remember, you can use today's source material, that parent guide, as a starting point. For more detailed information, helpful tips, resources on things like acute pediatric care, after-hours pediatric care, or complete immunization and vaccine information, please visit omegapediatrics.com.
And if you found this conversation helpful, we'd really appreciate it if you take a second to like this video or audio.
Yeah, definitely. And to make sure you don't miss future discussions on important child health and safety topics, please subscribe to the channel.
And finally, think about sharing this. Share it with other parents, caregivers, anyone who might benefit from knowing these critical signs. It can make all the difference.
Thank you so much for tuning in today for this important discussion.
Yes, thank you. Stay safe, stay informed.
Goodbye for now.
Farewell.